Hi, good evening, everybody. Welcome to my next Facebook Live. So, for people who don't know me, I'm Dr. Natasha Williams. I'm a clinical psychologist, keynote speaker, and published author. I am so happy to have you guys join me today. So, as I mentioned last week, my topic this week is going to be identifying depression. Now, what I find is very interesting is with depression, with that term, a lot of times we use it in very layman's terms. So the minute we're starting to feel a little off or sad, we use the term, I'm depressed or I'm feeling sad or something along those lines. What's very interesting is that clinical depression is very different. So what I want to make sure is that we differentiate. So listen, we are human. Remember, I had one of my lives, we were talking about the permission to be human. And this is important because as human beings, we go through a variety of emotions. We are not programmed to be happy all the time. So it's understanding that we are going to have ups and downs. There are going to be times when you are going to be sad, when you're going to be upset, frustrated, and we need to embrace all of those emotions. So when the situation warrants, it's fine to be sad, especially during times of grief or mourning. Disappointments can also make you sad as well. So the sadness in and of itself does not necessarily constitute a clinical depression. And I think that's the most important thing that we have to really look at. This is something that a couple of us as professionals are able to diagnose using a diagnostic manual or whatever the case may be. So when we're talking about clinical depression or major depressive disorder, as per the DSM or the ICD, these are the manuals that we use to look at a variety of symptoms to see if an individual actually meets criteria for these disorders. What we need to make sure that is very important is that there's a range of symptoms. And not only that, with depression, we have to see not only the symptoms, but how the symptoms are impacting the person's life. So as you usually know, I like to start with just a bit of a definition so that we can all be on the same page and really understand what we're talking about when we're talking about major depression. So once we have a definition, then we can understand how we can identify it and how we can possibly see it in ourselves or others. And at what point do you really need to get help with this? So I'll start with a clinical definition. Major depression is a serious mood disorder that negatively affects how you feel, the way that you think, and how you act. The symptoms of major depression can seriously interfere with a person's ability to handle daily activities, relationships, or work and school responsibilities. So this is the critical piece, because it's not only that you have the symptoms, but how are the symptoms impacting your ability to function on a day-to-day basis. So if we just put this in practical terms, we have something what we call the ADLs, or the activities of daily living. And there are components of depression that can negatively affect your ability to do these activities of daily living. So let's talk about the symptoms first, and then from there we can talk about how it could impact these daily living activities. So for someone to be diagnosed with major depression, we're looking at a few things. The first thing that we're looking at is a person that is sad, depressed, or feeling low. Hi, Nadia. Thank you so much for joining. Someone who is sad, low mood, depressed, flat, more days than not, for at least 2 weeks or more. Hi, Rashawn. Hi, thanks for joining. So we're looking at it strictly if we're looking at that disorder. What we're looking at is at least a 2-week period that this person is flat, sad, all day, every day, more days than not. So when we're looking at when we're looking at it from that perspective, that's the first thing we're looking for. Now, to be honest, when patients are coming into my clinic, they have been feeling that way for way more than 2 weeks. But what we're looking for is what we call a major depressive episode. So I won't get into too many technical details, but this is that's the first piece that we're looking for. So is this person sad, flat, all day, every day, more days than not, for a minimum of 2 weeks? The next thing we're looking for is somebody who is no longer enjoying the activities that they used to enjoy. So we're looking at, are there activities, hobbies that this person used to engage in that they're no longer motivated to do? So if this person used to play sports, if this person used to go to the gym all the time. So these types of things. Used to either engage in different crafts, arts and crafts, scrapbooking, these types of things. We're now noticing that they're not engaging in these things any longer, and they don't feel that they want to. So they're losing motivation for those things that they previously enjoyed. The next thing that you'll notice is that they're going to start to withdraw socially. So you'll notice that they're not hanging out with friends, not spending time with family. And even if they live in a home that they're living with other people, they seem to be very withdrawn. A lot of times they're spending a lot of time in their room. So the social withdrawal is another huge piece that we notice when we're starting to look at a clinical major depressive disorder. Other symptoms that we start to look for are feelings of hopelessness. So I don't believe that my situation is going to be any better. It's not going to improve. I start to give up hope, motivation. Other things that we start to look for as well is sleep. Sometimes we think if a person is sleeping more, then that alone is a sign of depression, but it can go the other way as well. So what happens is that their sleep is impaired. So they're either not sleeping at all, up 24 hours, or just really broken sleep. So having difficulty falling asleep, difficulty maintaining sleep, or it can really go the opposite way. There are people that will stay in bed for hours on end and rarely even, go to even eat or anything of that nature. So you'll notice that the sleep is impaired. So then connected with that is going to be fatigue or lack of energy. People that are depressed really are lethargic. They don't have much energy, again, which then ties into motivation. They don't have the energy to really do much. So a lot of times you'll either see them in their room most times, or even if they come out of their room, a lot of times they'll just be sitting on the couch, not really motivated to go out to do anything at all. So the energy levels are really low. The other thing that we look for as well is appetite. Because for somebody that is depressed, appetite can go one of two ways. We can either notice that someone is eating more, so to sort of give themselves a little bit of comfort, what they will do is eat more. It'll happen the opposite way as well. So you'll have people that will eat less, that will not have any desire to eat at all. So we get that piece as well. So on top of that, now we then look for other symptoms. We look for, irritability, frustration. A lot of times people just become very irritable. They get angry quicker. They'll start to snap at others as well. And on top of that, then we'll also see impairments in what we call cognitive impairments. So which means we're looking at sometimes people don't remember things as well as they used to. So their memory is impacted. Concentration, or being able to focus, or being able to pay attention. All of these things become impacted. So again, that then can possibly impact things like being able to meet bills financially, being able to do your banking, and also the ability to enjoy activities such as reading or watching television. They're unable to follow a dialogue because their mind is so occupied, or memory and concentration is also impaired as well. One of the other things that we will notice with depression as well, which is a very serious piece, is thoughts of suicide or actual attempts. to take their own life or to harm themselves. That part ends up being very, very tragic because, again, when we've noticed some of the celebrities, for example, that have unfortunately taken their life, such as Anthony Bourdain, Kate Spade, Robin Williams. A lot of that is now going to be filtered in being diagnosed with depression, and depression that has not been discussed or even openly spoken about. So suicidal ideation, so we look at how severe these thoughts are. Are they having not just thoughts but actual intent? Do they have a ways or means of attempting to take their life? And that seriousness, for myself, when I do see patients when they are that serious, that's when we talk about hospitalization, being able to get to the emergency room. Thank you, Natalie, for joining. So we talk about hospitalization or possible psychiatric care. So these are some of the things that you would want to look out for. Now, when we're talking about these symptoms, how do they impact day-to-day life? So for a lot of the patients that I see, when we're talking about, when I mentioned earlier about ADLs, or activities of daily living, what you notice is that impacts their ability to function. So when we talk about activities of daily living, we start talking about, for example, household responsibilities. So if an individual is in charge of cooking, cleaning, laundry, taking out the garbage, maintaining the lawn, and you notice that these things are no longer being done, they're not interested in doing these things, that's going to start being a bit of a sign that something is going on. But not only those household chores, caretaking responsibilities as well. So you'll notice if this person has children, that they're not tending to the children as much as they used to. They're not engaging or playing with the children as much as they used to. Again, removal. It's being a bit more despondent. Now, even talking about personal care. So we talk about bathing and dressing. So a lot of the patients that I've seen, what they will tell me is that because they're not going anywhere, they don't feel motivated, they'll wear the same clothes for days on end, and sometimes they will not bathe or engage in other personal hygiene, such as brushing teeth and those kinds of things, sometimes for days, because they are just not motivated, and they believe that I'm not interacting with anybody, I'm staying home, I don't care. So we get into the cycle where you're noticing that the activities of daily living are being affected. Now, if we even take it outside of that as well, when I also mentioned that other areas are now also being affected. Depression as well as anxiety, but mental illness such as depression is one of the number one issues in regards to productivity at the workplace. Loss of revenue as a result of not being at work, taking mental health days and sick days, not being able to attend to work. So companies now more than ever are really trying to address mental illness in the workplace because there is a significant loss of productivity. More than any other illnesses and things combined, mental illness is really affecting the companies and their bottom line. So not being able to get to work, or actually getting to work but either not being productive, making a lot of mistakes, that's going to be an issue as well. For students, what ends up happening is that your inability because of cognitive compromise or not being able to focus or to concentrate or to retain information, you'll notice that with the people that I see that are students, university, that type of thing, you'll notice that their grades start to go down. So you notice that their school performance also is negatively impacted. In regards to relationships, I've noticed that relationships as well become strained as a result. Marital relationships, you also have what we call a loss of libido. So there's no desire to be intimate or to be connected with your partner. So a lot of that withdrawal then also negatively affects relationships. And then as a result, if relationships end, that then also deepens the depression, because now it's like, now look, I'm ill and now nobody wants to be around me, so I'm withdrawing. And then as a result, people are also being pushed away. So it ends up being this negative cycle that keeps on going over and over again. So these are some of the things that you will notice, maybe even in yourself, but also in others. So what I would like to do is just talk a little bit about, well, these are the signs and symptoms that I've just mentioned before. What can we do? So there are different ways to treat depression. So we look at it from a psychiatric perspective. So just mentioning, I'm not a psychiatrist, so I don't prescribe medication, but also understand that medication is one way that we can look at depression, because with the severity of these symptoms, it actually can alter brain chemistry. When you're in that kind of mood altering state for a significant period of time, what happens is that the chemical balance in the brain can be altered. So psychiatrically, it's important to see how possibly medication, psychotropic medication or antidepressants, can actually be a helping factor in being able to manage the symptoms. A lot of times when we look at depression on a variety of levels. You can look at it as a single episode, you can see it as something that is recurrent, but also we look at it as mild, moderate, severe. So the increased severity of the symptoms a lot likely means that medication might be an option. And I know for some people that are watching that sometimes even talking about medication is difficult, because a lot of times there's a lot of misconceptions about medication. A lot of times what I will tell people is that really be able to speak to your family doctor and or your psychiatrist, if you have one, in regards to your concerns about medication. Because a lot of times you don't have to be on them for the rest of your life, but they actually help to manage the symptoms in such a way that you're able to function. A lot of times as well, it takes about at least 6 weeks or so to be able to start getting the effects of the medication. So you really want to keep a close relationship with your psychiatrist and or your family doctor who is prescribing these medications. Now, I believe that is one way. As a psychologist, what I do is we engage the client in psychotherapy. So being able to really understand thought process and how it is impacting their ability to see things and view things, so that we can then look at how do we then what we call restructure, or look at changing how they're perceiving things and providing them with coping strategies to deal with these life events, but just also being able to alter how they're thinking. One of the methods that have been very popular is what we call cognitive behavioral therapy, or CBT. That's what we've seen a lot of times when you sort of look it up. And when we talk about cognitive behavioral therapy in particular, it's basically the way that you think is the way that you act, is the way that you feel. And it's in a cyclical dynamic, just basically meaning that one affects the other, affects the other. So if we're able to intervene in your thoughts, it should affect the way that you feel, it should affect the way that you behave. Similarly, if we start to target some of the behaviors that are associated with depression, then that should alter the way that you think and alter the way that you feel. So I won't get into too many clinical details, but that is sort of the premise in terms of being able to be treated. Now, mind you, when it comes to depression, having that combination of medication as well as psychotherapy is ideal. when it comes to being able to be treated for depression. Now, mind you, a lot of times people don't have access to both. So sometimes you get one and not the other. But I think the most important thing is going to be being able to understand what are some of the signs and symptoms, not being ashamed that you are suffering from depression, and being able to address it, maybe at first with your family doctor, and then from there being able to find outlets to be able to adequately address it. Again, myself as a psychologist, I have the ability to not only diagnose but to treat depression. And there are other mental health professionals who are also able to treat depression using psychotherapy, counseling methods, and in regards to medication, we look at, again, family doctors and psychiatrists. So there are a variety of ways that depression can be treated. But here's the other thing. I think what can be very difficult is, especially when you see a loved one that is going through this, it can be difficult to support that person because that individual is going through so much and it is really impacting their day-to-day function. So in regards to that, what I usually tell people is that the last thing you want to do is to try to force somebody to get help. Because trying to push somebody to get help can actually make matters worse. Because psychotherapy, for example, there has to be a relationship between the therapist and the client. So it can't really be a one-way thing. There has to be a buy-in with both for psychotherapy to be effective. There has to be a push and pull, but there has to be a relationship that's going on. There has to be some sort of willingness for the client to engage so that they can actually receive the full benefits of psychotherapy. So trying to force somebody to engage in treatment ends up being very difficult. It's the same way when I have somebody that is asking about medication. I don't force somebody to say you have no choice but to go on medication. What I do encourage is that they inform themselves about medication, which means not just going online and seeing what the side effects of medications are, but really have a conversation with your family doctor, with your psychiatrist, so that you are fully informed about the medications and its effects. So the best advice that I would give is to continue to be supportive and be able to talk to somebody on your level, how you believe that the symptoms have been impacting you and what you have seen. So for example, what I would tell somebody to do is to let the other person understand how the symptoms are impacting them. I have noticed that that you've been withdrawn and that you've been quite sad. I'm here for you. I'm not here to force you to do anything, but just know that I'm here if you need me. I'm concerned about you. I'm worried about you, and all I would love is the best for you. So I'm here whenever you need me. And to continue to have that kind of supportive outlook. It may not be easy because, again, while this person is depressed, a lot of times they are pushing people away. They don't want to talk to anybody. They don't want to be around anybody. They want to be alone. The difficulty with depression is that the more you isolate yourself, the deeper the depression becomes. So a lot of what I would tell my patients to do is to actually break the depression, is to actually to do the opposite of what you're doing right now. So the more you're isolating yourself, the more you're withdrawing, the more that you're staying in your room, actually is making the depression worse. So to be a supportive ear, to be a good friend. And here's the other thing, you may have to give them that bit of distance because they may push you away, but I'm hoping that you don't necessarily take that personally. the more that then you withdraw and say, well, forget about this person. I don't want to deal with them. That's it. Unfortunately, what happens is that it strengthens the negative thoughts that they've been having about themselves. Well, nobody wants to be around me anyway. Look, my friends are leaving me left, right, and center. So I'm just proving that I'm worthless, that I have nothing to live for, and that's it. So I would say, if nothing else, just to allow them just to be supportive and to let them know that you love them, that you want the best for them, that you'll be there for them if they need, and to just be there for them. Sometimes even sending them a quick message. They may not respond. When people are depressed, the last thing they're doing is checking their WhatsApp or their Instagram, their Facebook. A lot of that ends up being issues as well. So they don't want to even deal with that. But just to stay connected, I think, is going to be one of the most important things that you can do to support somebody. If it's you that is dealing with a lot of these issues and you're noticing that it is impacting, please know that it is not shameful to be going through this. People who even look like they have it all together can still suffer from major depression. So it is not that you're lacking anything. It's not that you are less than. It's that this is a mood disorder and that you may need help, and to reach out for that help. It may start with your family doctor. It may be reaching out to someone like myself who's a psychologist or a mental health professional, a counselor, being able to connect with that person who not only understands but will also assist you on that journey to feel better. So my hope is that as we close this live for today, that this information was helpful, because I know that there is a lot of people out there that are not only suffering with major depression, but they're also suffering in silence. So my hope is that this has been helpful, and that by the end of this live, that if you do know somebody, that you can just reach out a helping hand or just a comforting hand to them. My hope is that you'll be able to click on my link. So I do have a link on my webpage, which is www.drnatashawilliams.com. There is a link there which offers a free worksheet about how to get yourself on your journey to betterment. So for example, if this live was helpful and you're starting to notice some of these symptoms, I'm not saying that the worksheet will help to treat depression, but my hope is that it will be able to start answering some questions for you about yourself and being able to start your healing journey. So please feel free to click on and be able to download that worksheet. So again, I hope this live was helpful. Next week, same time, Wednesday at 7 p.m., I'm going to be back here and I'm going to be talking about tips for a healthy relationship. Relationship not only with other people, but relationship with yourself. So please feel free, tune in next week, same time. I hope you guys have a great evening, and I'll see you next week.